Most every senior needs to have prescription drug coverage. This video will help you understand the changes that are happening and improving the Medicare drug benefit. Okay, remember, Medicare did not cover prescription drugs for an outpatient basis until 2005. That is amazing, but that's the way it happened. And these initial drug coverage amounts were based off the national average of drug spending. And today we have an umbrella protection that helps people to prevent any sort of high drug cost. So major improvements have occurred from 2011 to 2024, and now we've got new improvements that are happening from 25 to 29. For example, the hated donut hole has been eliminated for 2025 going forward. Wow, I know this can be confusing. Medicare designed this, and some plans have a deductible of $590. That is an annual standard. Doesn't mean your plan's going to have that. But every plan has what is called an initial coverage level, where you pay no more than 25% of the cost of your drugs. You might pay less than that. And there's no donut hole to worry about anymore, so that's nice. And the out-of-pocket spending limit for you personally is $2,000. And then you have millions of dollars of coverage after that. So you might have $200,000 worth of drug spending, but your portion is $2,000 maximum. In fact, some people pay way less than the $2,000. There's a big problem. Most seniors are not reviewing their drug coverage each year. Well, this year was a big year. A lot of changes happened. We used to have 30 drug plans per county. Now we're down to 14. So a lot of seniors were forced to do their drug review, which they should have been doing each year, and they discovered they were spending $1,000 a year more than they should have. That's the national average error per person. It's horrible. And that is caused because people don't check their premiums, they don't check their pharmacy to make sure that they're buying at the correct pharmacy, and they don't do their review. You can do this every year at Medicare.gov. You create your personal account. All your drugs should be listed in there if you're buying them all through your Medicare plan. And you'll type in your pharmacy. You can compare 2 or 3 pharmacies, that's fine. And then you hit go and it'll tell you, are you on the right plan for next year? If not, here's the right choice for you, and you can hit enroll. It's very simple. But remember, all plans are going to have some sort of monthly premium. And so one plan might have a dollar per month premium, and another one might be $100 per month. It does not mean that $100 a month plan is better than the $1 a month plan. Crazy, but I encourage you to do your drug review every year. Now, high-income people, they're going to pay a surcharge on their drug plans. That does not reflect in the drug review. That's a separate surcharge, and you have to be aware of that. So how about those low-income seniors that can't afford their drug benefits or their drug costs? Social Security has a program called Low-Income Subsidy or Extra Help, where if you qualify, they'll pay up to about $40 a month of your drug premium, and they will then also make it where your generics don't cost any more than about $5 a month, and your brand names won't cost any more than about $12 a month. That's a huge savings. If you have a $100 drug, it brings it down to $12. And also, there's no more deductibles for you. It's going to help you with your drug spending immensely. Apply for this benefit at Social Security's website. So there's a new program that came out this year for 2025 that's very similar to your electric bill balanced billing. On my electric bill, I ask them to spread out my bill so that it's fairly smooth throughout the year. Well, Medicare has copied this, and they have a prescription drug program called the M3P program. You just ask your plan to put you on the M3P program, Medicare Prescription Payment Program, and they will help you with your drug costs to smooth it out like your electric bill gets smoothed out. So you call your prescription plan, and they will add you to this program, and then also the pharmacy will need to know that you're on the program. Unfortunately, your agent, your Medicare advisor, cannot help you with this enrollment. You can either opt in or you can opt out if you don't like the program by calling your plan. Now, your plan then bills you. What this means is you're going to get a bill. So if you have a $2,000 expected drug expense next year, you're going to get a bill for $167 a month. 167 times 12 is $2,000. This is important. You are paying the plan, and when you go to the pharmacy or your pharmacy, your drugs come in the mail, you get them for free because you've already prepaid for them each month at $167 a month. So you walk into the pharmacy, I need this antibiotic, I need this cream, it's free, they just hand it to you. And then you can get to forget about deductibles and forget about price spikes through the year. It's going to smooth out your cost to be very budget friendly for you. So ask your plan for the M3P program. The Inflation Reduction Act has a whole timeline of prescription drug changes from the year 2023 to the year 2029. Well, we've made it through the first couple of years of changes, which helped people with diabetic drugs, helped people with some other issues, but 2025 is the first year where they're starting this prescription smoothing program and some other help, and starting to negotiate the prices of drugs. They've identified 10 drugs, very popular blood thinners and diabetic drugs and other drugs that are costing Medicare about $60 billion a year, that other countries and the VA get much cheaper than Medicare. Why are we getting ripped off? They're negotiating the prices. Well, they've identified 60 drugs that they're going to negotiate from 2025 until 2029. This is huge, and every year they're announcing the next set of drugs for the following year. So pay attention, your drug may be on the new lower priced target for 2025 and 2026. So what did we learn in this video? We learned that finding the right drug coverage is actually very easy. You just create your Medicare.gov account. Don't go to Medicare.com. Go to Medicare.gov, and your drug list will already be in there, or you can edit it or add drugs, add your pharmacy, and you can easily find the right plan. But you have to wait until October 1st and later, and then after October 15th, hit enroll, and you'll go to the right plan. Now, only do this if you're under traditional Medicare with a drug plan separately. But if you have a Medicare Advantage plan, you'd want to use Affordable Medicare Solutions. When you're making your plan decision, you're making sure your doctors are covered, your drugs, your pharmacy, and your hospital. We want to make sure that you're not messing up all of the other moving parts. So use Affordable Medicare Solutions if you're on a Medicare Advantage program. But if you're under traditional Medicare and you already have your supplement, just simply go to Medicare.gov to choose your new drug program.